Feeling full, gassy, and miserable even after a light meal? It might not be what you are eating, it could be where your bacteria are living. Welcome to the world of SIBO, small intestinal bacterial overgrowth, where good bacteria grow in the wrong place. Let's know more about it. Number 1. What is SIBO? SIBO stands for small intestinal bacterial overgrowth, a condition where abnormally high numbers of bacteria grow in the small intestine, disrupting normal digestion and absorption of nutrients. Number 2. What causes SIBO? SIBO, small intestinal bacterial overgrowth, occurs when bacteria that normally live in the large intestine start growing excessively in the small intestine. This can happen due to poor gut motility, low stomach acid, structural abnormalities, like strictures or adhesions, or malfunctioning of the ileocecal valve. Conditions like diabetes, hypothyroidism, prior abdominal surgeries, and long-term use of proton pump inhibitors, PPIs, also increase the risk. Number 3. What are the symptoms of SIBO? Symptoms of SIBO include bloating, abdominal pain or discomfort, excessive gas, diarrhea or constipation, and a feeling of fullness after eating. In some cases, it can also lead to malabsorption, causing unintended weight loss, fatigue, and nutrient deficiencies like vitamin B12 or iron. Number 4. How is SIBO diagnosed? SIBO is most commonly diagnosed using a breath test, where a patient drinks a sugar solution, like glucose or lactulose, and their breath is analyzed for hydrogen or methane gases produced by bacteria. Another method is the small intestine aspirate and culture, which involves taking a fluid sample directly from the small intestine, but this is more invasive and less commonly done. Number 5. What is the treatment for SIBO? Treatment for SIBO typically involves antibiotics like rifaximin to reduce bacterial overgrowth. Depending on symptoms, a combination with neomycin may be used. Dietary changes, such as a low FODMAP or specific carbohydrate diet, can help manage symptoms. Prokinetics may be prescribed to improve gut motility, and addressing the underlying cause is key to preventing recurrence. Number 6. Can SIBO come back after treatment? Yes, SIBO can come back after treatment, especially if the underlying cause, like poor gut motility or structural issues, is not addressed. Recurrence is common, and some people may need repeated courses of treatment or long-term management strategies such as dietary adjustments and prokinetics to help prevent relapse. Number 7. What diet is recommended for people with SIBO? For people with SIBO, diets that reduce fermentable carbohydrates are often recommended. The most common is the low FODMAP diet, which limits foods that feed bacteria in the gut. Others may benefit from the specific carbohydrate diet, SCD, or an elemental diet in severe cases. These diets help reduce symptoms like bloating and gas by starving the excess bacteria. Number 8. Can probiotics help with SIBO? Probiotics may help some people with SIBO by restoring balance to gut bacteria, but they can also worsen symptoms in others, especially if they promote gas production. Their use is controversial and should be guided by a healthcare professional, as not all probiotic strains are beneficial in SIBO cases. Number 9. What are the risk factors for developing SIBO? Risk factors for developing SIBO include impaired gut motility, as seen in diabetes or scleroderma, and low stomach acid. Long-term use of proton pump inhibitors, PPIs, intestinal surgeries, and structural issues like adhesions or diverticular are also risk factors for developing SIBO. Conditions like hypothyroidism, IBS, and chronic pancreatitis also increase the risk. Number 10. How long does SIBO treatment take? SIBO treatment usually lasts about 10 to 14 days with antibiotics like rifaximin. However, full recovery may take several weeks to months, especially if dietary changes and underlying conditions also need to be addressed. In recurrent cases, long-term management may be necessary. Number 11. Can SIBO cause nutrient deficiencies? Yes, SIBO can cause nutrient deficiencies because the excess bacteria interfere with nutrient absorption. Common deficiencies include vitamin B12, iron, and fat-soluble vitamins A, D, A, K, which can lead to symptoms like fatigue, weakness, and neurological issues if left untreated. Number 12. Is SIBO contagious? No, SIBO is not contagious. It is an internal condition caused by an imbalance of bacteria within the digestive system and cannot be spread from person to person through contact, food, or air. Number 13. Can lifestyle changes help prevent SIBO? Yes, lifestyle changes can help prevent SIBO or reduce the risk of recurrence. Key strategies include eating regular, well-spaced meals, staying physically active, managing stress, and avoiding unnecessary use of acid-reducing medications. Supporting healthy gut motility through good sleep and hydration also plays an important role. Number 14. Can SIBO be cured completely? SIBO can be completely cured in some cases, especially when the underlying cause is identified and treated. However, for others, it may become a chronic or recurrent condition that requires ongoing management through diet, medications, and lifestyle changes to keep symptoms under control. Knowledge is power, especially when it comes to your health. Like, share, and subscribe to Tiny Predators so you never miss an episode on the fascinating world of microbiology.